This section of infectious diseases, or IDS, came into being in 1968 to strengthen efforts in the war against persistent threats to the health of Filipinos. The first section head was Dr. Antonio Gonzaga. Inspired by the academic excellence of Dr. Gonzaga, many residents were motivated to pursue infectious diseases as a subspecialty. In the same year, the first fellow was accepted into the infectious diseases training program.
For a long time, we had always squatted in the office of IDS. We're the only ones willing to attend to cases of HIV. We had no office for HIV and STD. So again, we asked another parang storeroom from the hospital director, si Dr. Estrella. We expanded the IDS office kasi ang IDS office used to be just yung office lang talaga ng laboratory. When the central block was being constructed, we were housed in a dungeon. I call it dungeon kasi parang ganito lang yun. Nandun kaming lahat, no? And finally, we got that complex. Yung first modernized microbiology laboratory. Hindi siya MRL. Ang MRL kasi iba-ibang mga subspecialties. There is endocrinology, there is biochemistry, but it is just one floor. We were in that dungeon. We were still doing research. Nagre-research kami sa rheumatic fever. We were able to continue our research kahit na ganun kami sa dungeon. So, make the most out of it, no? Hindi naman yun talagang limitation na kasi wala ka nito, wala ka naman. Then, we also started the TB lab, pati yung diagnostic sa TB, pati PCR, and then we also converted kasi ang daming kaya naging complex yan. And then, it was during that time of Dr. Ramon Talban na yung Sagip office was divided into cubicles because there was need for parang privacy. That is how we improve the section. We tend to be focused more on curative. We can significantly reduce infectious diseases if we also focus on prevention.
On January 27, 1972, during the term of Dr. Rodolfo Howe as IDS head, the Philippine Society for Microbiology and Infectious Diseases, or PSMID, was founded. Dr. Howe, Dr. Gonzaga, Dr. Benjamin Limson, and Dr. Thelma Tupasi were among the 12 founding members of PSMID. They committed themselves to the study and research of infectious diseases and microbiology in the Philippines. In that same year, Dr. Thelma Tupasi assumed leadership of IDS and continued to serve for over a decade. She set up the Mycobacteriology Facility for the isolation of Mycobacterium tuberculosis and established the laboratory methods for culturing Leptospira at the IDS laboratory. Dr. Tupasi also organized the PGH Infection Control Committee to set policies and practices for the control of hospital-acquired infections and to implement surveillance programs to identify nosocomial pathogens and their susceptibilities to antibiotics.
During the early 70s, 80s, and even 90s is that we had very few number of fellows in training, because the government or the PGH did not have enough financial help to be able to, to support them. So we were really undermanned. So in fact, the fellows then there was a time when we only had one fellow who was both first year and second year who did all the work, okay? And that is really something, because in spite of the few numbers and the undermanned, we still did good work. In post-interns, were sent out to the different rural areas in the Philippines. So I was sent to a rural area in the province of Negros Occidental. Seeing the lot of patients who are quite poor, who cannot even afford to buy basic needs, you tend to understand how they are. Because of this, you tend to become a holistic. Okay, even if you're an internist, for example, you're an infectious disease, you don't just look at the infection, you want to treat the patient as whole, because you know that their problem is not just infection, so it's a whole thing. Probably 8 out of 10 patients you see every day were all infectious diseases. So I thought probably, if being idealistic at that time, if you want really to serve the people, so then I said maybe I should really choose infectious disease, because then I can help more people.
Inspired by the vision, a community of leaders in the practice of infectious diseases and public health committed to the development of Philippine society through the prevention and control of infectious diseases, working through equitable partnerships locally and globally.
I like doing research. I like doing laboratory work. Now, with the infectious diseases, you have to be good in laboratory clinical microbiology. You should know how to use the microscope and appreciate what kind of tests to use. It's an ongoing, continuing professional growth for us. You should know your internal medicine very well, because there are infections of the brain, heart, lungs. Any part of the body can get infected. Challenging is the research part and managing our patients without the financial resources. That's always a challenge, because knowing PGH, we have these indigent patients. When you make rounds and prescribe antibiotics, you can never be sure if your antibiotic prescription will be served. We started this training program when I was a fellow. My section head then was Dr. Telma Topasi. We learned through going rounds with our professors, with our consultants. At that time, there was no pay wards. So very important that we have at least once or twice a week rounds with our consultants. And that's how we learn. During my time, there was no computer yet. No? So we had to dig into the Index Medicus. Those are compilations of different literatures, different volumes by subjects, by authors. The old MRL was in the hospital. We had small rooms per section: hematology, rheumatology, endocrinology, infectious diseases. In one hall, we were divided into rooms, and we did our basic laboratories there, like basic cultures, gram stains, special stains. In endocrine and immuno, they do their basic laboratory works also, and hematology, they also have their own labs there. In the medical research lab, we depend on our researchers for funding. If you don't have a research with funds, you cannot move on. At the time, it was a little easier to get research funds, because there was the National Science and Development Board and the National Science and Technology Authority. Those are our main source of funding, and the National Research Council of the Philippines.
In 1960, the Medical Research Laboratories, or MRL, began as the laboratory of the Department of Medicine during the chairmanship of Dr. Paulo Campos. Initially located at the back of wards 1 to 4, the MRL was transferred to the second floor of the emergency room complex on March 1989. Funding to support MRL came from several government and private agencies, and in 1990, the MRL Trust Fund was created under PGH Director Dr. Felipe Estrella. In 2009, the IDS Laboratory and other laboratories under the Department of Medicine were integrated as the MRL during its ISO certification. Through the years, the IDS Laboratory of MRL has been providing services to patients and researchers as a specialized clinical laboratory. It has pioneered the use of several laboratory procedures and research collaborations, notably the first Kirby Bauer training for the country, acute respiratory infection research, integrated research on rheumatic fever and rheumatic heart disease, ELISA, and in-house molecular detection for both pulmonary and extrapulmonary specimens for TB, multi-drug resistant sentinel site surveillance project, and epidemiological genotyping studies on TB, and pioneered the application of leptospirosis mat technology transferred from US NAMRU. The IDS laboratory has been highly instrumental in developing and honing the diagnostic skills of the fellows in training and also engaging in collaborative research at national and global levels. Inspired by the mission, we are faculty and staff of the Section of Infectious Diseases at UP-PGH, committed to quality healthcare, training and research to help achieve the mission of UP Manila. We achieve this by leadership and excellence in holistic, compassionate, and evidence-based specialty practice of, training in, and research on infectious diseases in the service of the Filipino people and in the context of communities and global health. Over the years, IDS has undertaken a number of highly acclaimed studies, presented and published both locally and internationally, which benefit the well-being of Filipino patients.
There has to be a big cadre of infectious disease specialists to really combat the big burden of infectious diseases in the country. This specialty is a very rewarding specialty because of that very socially oriented goal of helping people, particularly the poor, in overcoming or controlling infectious diseases. So a very rewarding experience. When I was section head, we had very good crops of infectious disease fellows, intelligent, hardworking, and they worked very well together. So some were very interested in the clinical side, some in the research side, and some in the public health side. And here, it demonstrated how infectious disease practitioners can actually collaborate with a lot of other specialties to provide key information to guide our policymakers in the control of tuberculosis. So there was the clinical epidemiology side, the field epidemiologists helped, the biostatisticians helped, but really at the center of that, in the diagnosis of TB, the laboratory of infectious diseases was key to understanding the problem of TB in the country. We tried to expand the training program by proposing a joint program with the medical city. Unfortunately, that did not materialize because of some objections, but we did have a memorandum of agreement with the medical city to have rotation so that our infectious disease specialists see both the public side of healthcare as well as the private side of healthcare. There were researches by our young trainees and fellows together with our faculty members, and we are always proud to say, especially Dr. Salvania, in saying that these papers of our fellows are able to be presented in international conventions and regional conventions, particularly in the area of HIV. Our specialty, infectious diseases, can actually help reduce the burden of diseases both in terms of morbidity and mortality.
With the initiative and leadership of the IDS faculty, several subunits with roles related to infectious disease research, control and prevention were organized. Together with IDS, the STD/AIDS Guidance, Intervention and Prevention or SAGIP Unit, the Hospital Infection Control Unit or HICU, and the Anti-Rabies Unit or ARU constitute the present infectious diseases complex.
We found out that patients who came to the ER or OPD of PGH because of dog bites or other animal bites were not managed there. They were sent out to San Lazaro Hospital or RITM. So we thought something is wrong somewhere. This is a PGH and we cannot manage these patients. So we did a survey of the different residents who were on duty at the ER, and to our dismay, we found out that almost all residents assigned at the emergency room did not know how to handle animal bites. So we decided that we should put up this training in animal bites or anti-rabies so that we can help our patients. And so at that time, we talked to the director of the hospital and he said we can do that. However, the problem was the hospital had no money, to support. So we cannot pay your nurse. We have no place where to put you. To start with, the anti-rabies unit was a squatter in one of the OPDs, I think in the allergy clinic. So we had one table there, and the nurse that we assigned there, that we hired, was being paid, unfortunately, by some pharmaceutical company. The rabies vaccine and the immune globulin that we gave to the patients were donated to us. So that's how we started. From that time on, 2 years later, we were able to pay our own nurse already. At that time, we wanted the section to grow, not only to grow in number, but in quality as well. So we want to produce good doctors, good fellows, good residents among ourselves. So our driving force is to do everything we can to make the section really great in terms of quality and quantity.
The PGH Infection Control Committee was officially organized on January 11, 1978. Dr. Thelma Topasi served as the first chair until 1981, when Dr. Milicia Belmonte succeeded her. In 2003, under Director Juan Maria Pablo Nañagas, the PGH Infection Control Committee became the Hospital Infection Control Unit, or HICU, under the Office of the Assistant Director for Health Operations. With the retirement of Dr. Milicia Belmonte in 2007, Dr. Regina Berba became head of HICU.
I was very fortunate that I had a mentor, Dr. Belmonte, our first graduate, who was really a mobilizer in terms of getting things done. She started basically sa GIP and the infection control unit of the hospital. When she retired, she passed on to me the care of sa GIP, the HIV unit, and I really saw the growth in this particular field in terms of number of patients, and as far as the medicines that are now made available. There are a lot of challenges with infection control. And although it's never ending, one problem will crop up after the other. You actually develop patience, you develop investigative skills, develop diplomacy with people in the hospital. And even beyond the hospital, basically, the society can actually become your patient. The resistance of antibiotics is really staggering. I don't know, during our time, we were just looking at very few problems in terms of resistance. But now I don't know how it will be in the future as far as resistance of the organisms to our antibiotics. It will be a bigger problem in the future unless we do something now. Before, we didn't have any staff. Probably it was just Mrs. Gomez, although we still are lacking in terms of the personnel. I'm glad that the staff, fellows, are developing even a more personal relationship with their patients. And I'm glad that this is happening in the Philippine General Hospital setting. It is truly a joy to see them rise up as stars in their own right. We have graduates who will stay here with us, we have graduates who will go to the nearby hospitals, and graduates who will be sent to far-flung areas. And I feel that as part of the training staff of this institution, that one aspect of training people who will serve the community is a strong driving force for my involvement in the college. And that gives me a sense of joy that what we're doing here in the hospital is making a mark even beyond the Philippine General Hospitals.
The SAGIP unit was established on December 11, 1997 with the aim of providing comprehensive care to HIV/AIDS patients, as well as educating and training PGH healthcare workers. SAGIP is recognized as a special unit under the Office of the Deputy Director for Health Operations with Dr. Jador Lim at the helm. The unit collaborates with the Department of Health and several NGOs. It also has links with WHO and other global organizations. The UP-PGH Society of Infectious Diseases Alumni, or UPSIDA, was established in 2004, headed by Dr. Mirna Mendoza as President and Dr. Lita Visconde as Vice President. Dr. Regina Berba and Dr. Manolito Chua served as Secretary and Treasurer, respectively. The first set of regional representatives were Dr. Vicente Quimpo for Luzon, Dr. Elfleda Hernandez for the Visayas, and Dr. Viglor Maginsay for Mindanao. The UPSIDA mission is to promote the principles and best practices in infectious diseases through service, training, research, and advocacy that will ensure quality health care for Filipinos, especially the underserved. It envisions its members to be leaders and innovators in infectious diseases in the Philippines. To advance its mission and vision, the UP-PGH has been organizing biennial conferences across the country since 2005.
Where does DOH get their consultants? From our graduates. We produce leaders, excellent leaders in the country. Those are the rewards of our accomplishments in this section. I'm very proud that I started it. Hindi ko alam kung anong magiging outcome kung hindi kami nag-start. Fulfillment, rewarded. We still have to do a lot, work harder. We know that we are well recognized internationally and we have to maintain that.
In 1968, the section of infectious diseases admitted the country's first fellow in training, Dr. Melicia Belmonte. Among the earlier graduates were pediatrician Dr. Salvacion Gatchalian and obstetrician gynecologist Dr. Ricardo Manalastas, who eventually established IDS training program in their respective specialties. The IDS faculty is proud to have in their roster exemplars in the field of infectious diseases. Several members of the faculty were recognized as Most Distinguished Researcher by the Philippine College of Physicians or PCP, including Dr. Thelma Tupasi in 1994, Dr. Jaime C. Montoya in 2001, Dr. Myrna Mendoza in 2005, Dr. Mary Ann Lansang in 2006, and Dr. Marisa M. Alejandria in 2012. Dr. Thelma Tupasi was awarded the PCP's Dr. Gonzalo Austria Memorial Award in 2006. Several members of the faculty received the Outstanding Young Scientist Award from the National Academy of Science and Technology. Dr. Thelma Tupasi in 1981, Dr. Mediadora Saniel in 1985, Dr. Mary Ann Lansang in 1989, Dr. Jaime Montoya in 1998, Dr. Raul Destura in 2008, and Dr. Edsel Salvania in 2010. Dr. Thelma Tupasi was also named one of the 10 outstanding women in the New Society in 1983. Dr. Mediadora Saniel as one of the 10 outstanding women in the nation's service for medicine in 1992. Dr. Edsel Salvania and Dr. Raul Destura were named one of the 10 outstanding young men of the Philippines in 2010 and 2011 respectively. Dr. Thelma Tupasi was awarded the lifetime status of honorary member by the International Union Against Tuberculosis and Lung Diseases last November 3, 2013 in Paris. Thus far, the section has produced 125 competent, compassionate, and dynamic specialists in the field of infectious diseases. They have since gone on to serve in key leadership positions among public and private institutions throughout the country. Today, as IDS moves forward to the next 50 years, it remains true to the cause that inspired its establishment, and it will continue to work faithfully in line with its vision, mission, core values, and goals.